So when considering implementation science, it's especially important when working in low-middle income countries because, as said, they face the highest burden, lowest resources, and they don't benefit from the evidence-based interventions developed in most of the Western countries.
Implementation science is saying, let's take an intervention that works, or we think works according to the literature, and see how do you make it work in a different context.
We performed this situational analysis in which we researched the perspectives of mainly adolescents, but also providers that are important to them, so teachers and healthcare workers, about the topics of tobacco use and air pollution. We included approximately 100 participants in qualitative research within those 5 countries. We found out that adolescents are actually very knowledgeable on these topics and do really want to make a change.
So what we do is take the intervention and together with the country teams try to tailor, to adjust the intervention, make an implementation plan to be able to get the intervention working in different contexts.
Make interventions as tailored as possible to the context and to implement them in a way that also is sustainable for the future.
FRESHAIR4Life has posed a few challenges there because you're having to adapt evidence-based interventions for 2 different things. Develop it for and adapt it for the country context, how the primary care system is set up, but also for adolescents. Most of the evidence is based on adults, not adolescents. So there are 2 big challenges that we are addressing in FRESHAIR4Life. It's challenging for the research teams, and therefore we need this collective response to try and find ways through it.
Implementation failure is widespread, so even in countries that do have a lot of resources, only 5 to 10% of interventions gets implemented and maybe only 2% gets sustained in the long term. Especially interventions like prevention, where the outcome, the results are not always visible to the professionals, to the students. It's a long-term journey in that sense. It takes even maybe years to see results. Especially in disease prevalence.
So there are some interventions which have been shown to be effective in some countries in protecting people and also young people from being exposed to tobacco and air pollution, and we are trying to use these interventions. So for example, if we talk about tobacco use, we are thinking about preventing tobacco use. One intervention that has been quite effective is what we call an if-then plan intervention, also called as an implementation intention. What it is that it gives young people some skills in how to refuse tobacco. If you think peer pressure is one of the biggest factors in initiating tobacco use, so this intervention gives the young people skills in refusing tobacco, refusing an offer of cigarette. So it's about planning, about when you are offered a cigarette or a tobacco product, what are you going to say to refuse that? And if you've got that plan in your head, then you're more likely to implement that plan. So we are trying to get young people to develop these skills so they can be protected from peer pressure and tobacco use. Another intervention that could be effective for people, especially who are already using tobacco and wanting to quit, or we want them to quit, is called the very brief advice. And this is again a very proven effective intervention whereby it's an opportunistic conversation that health professionals or anybody who's trained in doing this asks young people whenever they visit for any health problem. They ask about whether they smoke, and then they advise about the benefits of quitting smoking, and then they act in terms of referring them to somewhere they can get support for quitting smoking. For air pollution, again, we are focusing on how to reduce your personal exposure.
One of the features of air pollution is they're invisible. Quite often you don't realize that you're exposed to quite high levels for short periods, especially when you are performing certain activities. And this is especially the case if you suffer from any respiratory disease. So actually knowing your exposure to air pollution is extremely important so that you can reduce these exposure, and that can improve your short-term health effects.
There are some things you can do to, for example, in some countries there is a high exposure to household air pollution. This is because of people using unclean fuels such as the solid fuels for heating and cooking, some of the stoves or cooking technologies which are contributing to household smoke and household pollution. So it's about how we protect young people specifically from this kind of exposure.
And what our results demonstrated is that you can come up with measures to reduce your personal exposure indoors, for instance, by while you're cooking, you can actually open the windows, or you can cover when you're cooking. And there's considerable reduction in your air pollution because of that.
Also, switching to cleaner fuels and cleaner fuel technologies is another thing that you could do to protect yourself, and there are lots of government schemes and other NGOs are also working in that area to provide people with cleaner cooking solutions.
And outdoors, you can choose less busy streets in order to travel from place A to place B. And we demonstrated that you have much reduced exposures when you do that.
Very little things will make bigger difference to adolescent health.
These were methods that you could actually use in your everyday life, which is very simple to use. And we're going to be disseminating these messages via the social media.